I'm hoping these folks tonight, who are all gifted teachers and gifted clinicians, will share their passion and their knowledge about the kidney and the urinary system with all of us. Dr. Ryan, he's the Director of Clinical Renal Services and the Section Head of Nephrology, the study and treatment of kidney diseases at Harborview Medical Center. He's the course director for the UW Medical Students Nephrology Curriculum. They call that the Urinary Systems course. And Michael took that course and made it one of the all-time favorite courses for the second-year medical students. His research interests are in clinical studies of acute renal failure and metabolic changes in intensive care unit patients. He's an excellent clinician with numerous teaching awards, and he's been named Distinguished Teacher 4 years in a row, and so they won't let him win that award anymore. And he received his MD degree from the University of Michigan. He did his residency in internal medicine at the University of Washington. I remember Mike as a resident, and his nephrology fellowship at the UW. And after Dr. Ryan, it's my great privilege to introduce to you Dr. Pat Fleet. You know, at the University of Washington, we truly have Nobel Prize winners, but we also have legends in clinical medicine. Those are folks like Dr. Mike Kopis out of the Trauma Center at Harborview, Dr. Marv Turk in infectious diseases, Dr. King Holmes in sexually transmitted diseases, and Dr. Pat Fleet is one of the University of Washington's own legends, not only as a clinician, but as a gifted educator. He works in the Division of General and Internal Medicine, as well as being a very active nephrologist throughout the University of Washington system. His diverse and eclectic, I like that, Pat, eclectic, group of interest in general nephrology include fluid and electrolyte metabolism, acute renal failure and chronic renal failure. And he has strong, passionate interests and concerns about current healthcare delivery systems. Dr. Fleet has won numerous teaching awards, including the UW Medical School's Teacher of the Year, as well as the Beeson Award, and has also received the Haviland Award from the Northwest Kidney Foundation for his contributions in kidney care in Seattle. Again, he practices out of Harborview. He received his MD from Creighton University and internal medicine residency and nephrology fellowship at the University of Washington. And will you please give these folks a warm welcome of applause.
But first we're going to start with a case. So this is a patient that came to Harborview a little while ago, and I'm going to present this as we usually present medical patients when we're teaching medical students or discussing cases in the hospital. CC is chief complaint. So this is a 22-year-old man who was admitted to Harborview with a 90-pound weight loss. He was tired and he was unable to work. About 3 to 4 months ago, he had progressive nausea. His appetite fell off. He wasn't able to sleep consistently at night, but he slept mostly during the day. He also had headaches. His past medical history was pretty unremarkable. He had no diabetes, no hospitalizations, no transfusions. But at age 16, when he tried out for the football team, he had protein in the urine, or something that was wrong with the urine. He couldn't remember. At age 19, his blood pressure was 160 over 110. He was given some medication for that. He took it till it ran out. He didn't fill it, and he didn't go back to see the doctor. He didn't smoke, he didn't drink, he didn't do recreational drugs. He was unemployed when we met him. He was a single parent of a 3-year-old daughter. He was living with his parents at the time. PE, his physical exam, his blood pressure in the emergency room was 230 over 120. His heart rate was 80. His weight was 180 pounds. And we looked in his eyes and we saw that he had big-time hypertensive changes in his eyes. So he had had high blood pressure for quite a while that was significant. His lungs were clear. He had this interesting noise when we listened to his heart. He had what we call a friction rub, so we could hear friction in there. He also had swelling in both of his legs. I didn't put all his labs down, but I put a few down. He was anemic. His hematocrit was 18, and normal's about 40 to 45 or so. He had too much acid in his body. He had a metabolic acidosis. His potassium level was high at 6.4, and he had this blood test called plasma creatinine, and his level was 22, and a normal should be about 1. And we'll talk about what that means in a little bit. When I talk to the medical students, I always ask them, why are you here? And usually they say, why are you here? So I'm going to tell you why I'm here. My goals tonight are to talk about the kidneys and to convince you why you should care about your kidneys. We'll talk just a little bit about what the kidneys do. Now, I have 40 hours with the second-year medical students to talk about what the kidneys do, and we have about a half hour tonight, so we're going to condense. We're going to talk a little bit about how they do what they do, and then we're going to talk about how do I know if I have kidney disease. So what are the symptoms I might have, what are the markers, and what are some of the lab tests that might point us in that direction. Before we do that, I want to clear a few things up. I talked to my brother the other day, and he said, how's the phrenology business going? So who is this guy? Am I a urologist, phrenologist, or a nephrologist? Well, I'm C. I'm a nephrologist. A urologist is a surgeon, so that's a branch of surgery. Phrenology is a study of the shape of the head where you can figure out if someone has criminal tendencies. And I'm a nephrologist. That's a part of internal medicine, so I take care of patients with kidney disease. All right. Here's the other reason I'm here. The number of patients in America with ESRD, that's end-stage renal disease, or kidneys that aren't working, is on the climb. This is actually an old slide now from 2000, but what you can see on the y-axis is the number of patients in thousands, and on the x-axis is the year. And you can see the numbers going up, up, up. Although this is an old slide, these numbers that were projections at the time are accurate, and you can see it's continuing to climb. And Dr. Fleet's going to talk a little bit more about that. Here's some more facts. 20 million Americans, about 1 in 9 U.S. adults, have chronic kidney disease, and another 20 million more are at increased risk. Last year, we spent about $27 billion in America taking care of people with kidney disease. That's about 6.5% of the Medicare budget. That's about what we spent for the entire NIH budget. The good news, though, is early detection can prevent the progression of kidney disease and save a lot of money and heartache. Now, we know that the best spot to get our news is from TV, but unfortunately, TV news is dropping the ball. And this slide is a summary of an article that just came out in December of '06. And what this group did is they looked at almost 1,800 news stories on TV in 50 cities in America. And this was the TV catchment area for about 60% of Americans. So they just looked at 1,800 stories that were shown during 1 month. 2 of the stories discussed kidney disease. One of them was about kidney stones. The other one was about some guy who donated his kidney. 19 of them discussed hypertension. 14 discussed diabetes. 0 of them mentioned chronic kidney disease or dialysis. At the same time, 166 stories mentioned West Nile virus. So it's just not hitting the news. So most Americans and most residents don't really know about this kidney disease thing. All right. So that's a brief introduction. So let's talk a little bit about what the kidneys do. Well, the first thing you got to know is they get about 25% of the cardiac output. So 25% of the blood coming out of the heart goes directly to the kidneys. So you know they're doing something important if they get that much blood. This is what we normally think of when we think about the kidneys, getting rid of metabolic waste products. They get rid of acids and urea, uric acid, creatinine, and hemoglobin breakdown products. That's definitely one thing the kidneys do. They also do a very interesting thing in that they regulate how much fluid you have in your body, and they regulate the osmolality of the body. They also regulate how much water you have in your body, and they regulate the concentrations of all these ions that I've showed here, sodium, potassium, chloride, calcium, phosphorus, and a bunch of other ones that I didn't listen. So they're busy regulating these all the time. They also get rid of foreign chemicals. So they get rid of drugs and pesticides and food additives. They also have an endocrine function. And normally when we think of vitamin D, we think of milk and we think of getting out in the sunlight. But we might forget is that the final step in the conversion of vitamin D into its active form happens in the kidney. So this here is the kidney, and it's putting hydroxyl group on to form 1,25-dihydroxy vitamin D, which is the active form of vitamin D. So the kidneys are integral in vitamin D metabolism and therefore keeping bones healthy. The kidneys also regulate how much blood you have in your body. So if you start this diagram right here, this is a normal amount of blood in the body. This is what anemia would look like, low blood, not enough blood. The kidneys sense the low blood, hypoxia, which means not enough oxygen delivery. They sense that, and they secrete a hormone called erythropoietin, which travels to the bone marrow, so the bone marrow can make red blood cells and correct the anemia. So the kidneys are actually regulating how much blood we have in our body. The kidneys also control blood pressure. So let's say you go out for a long run and you get a little bit dehydrated, your blood pressure gets a little low. The kidneys will release hormones, and I didn't put them all down here, but they'll release hormones to raise the blood pressure. They'll also retain sodium so the blood pressure comes up. Likewise, if the blood pressure goes too high, if you have too much salt in your body, they'll get rid of the salt to try to regulate the blood pressure. So, how do the kidneys handle something like this? Typical American dinner. We have some protein there. We've got some phosphorus in the cheese. We have some potassium in the ketchup. We have a large soda here with a lot of fluid. And we have a lot of sodium in both the burger and the salt. So how do the kidneys handle all that? To understand that, I'm going to talk just briefly about one part of kidney function. To do that, we'll talk about what the kidneys look like, first of all. So there's two of them. And they're about the size of your fist. They're in the back. And the blood flow comes into the kidney from the inside and goes all the way to the outside, then travels back out through the renal vein. And most of the business that I'm going to talk about in the next few minutes is happening in the renal cortex, which is the outer centimeter or so of the kidney. Each kidney has about 800,000 to 1 million nephrons. This is the filtering unit in the kidney. There's about 1 million of them per kidney. And this is a schematic diagram of what a nephron looks like. There's a glomerulus and the tubule. So you can see the whole thing starts here with the glomerulus. The blood comes in. Then the urine starts to get formed, goes downstream through the tubule, and then ultimately out through the ureter into the bladder. Here's a close-up of the glomerulus. And what you'll notice is very interesting here. An artery comes into the glomerulus. Here are capillaries here, capillary loops, and then an artery goes out. It's the only spot in the body where an artery goes in and an artery goes out. Usually an artery goes in and a vein goes out. Artery goes in, artery goes out. This is where the urine starts to form. Fluid goes from inside the capillary to this space here called Bowman's space, or Bowman's capsule right here. And then urine is formed and it goes downstream into the tubule. So that's where the filtration starts to happen so we can get rid of waste products. Here's an electron micrograph of those capillary loops. So the Bowman's capsule is removed and we're just looking at the capillaries here. And you can see how tightly wound they actually are. This is one glomerulus. So each kidney has about 1 million of these. Here's another schematic diagram of a nephron. And what you'll see, here's a glomerulus here. Here it is right here. Here's the glomerulus here. Artery going in, artery going out. And look where the artery goes after it leaves the glomerulus. What it does a very interesting thing. It wraps itself around the tubule. So it's right next to the tubule on the way out. And what this diagram shows is how urine is started to form. The first thing that happens is stuff is filtered from the capillary into Bowman's space. And what you'll see happens downstream, other stuff actually comes across the border from the blood vessel into the urinary space, and other stuff goes from the tubule back into the blood vessel. So this is how the regulation happens. 20% of the plasma that goes into Bowman's space goes across and starts to form this urine. The rest just keeps going downstream. And what's interesting to note is the concentration of small ions is the same right here as it is in the bloodstream. It goes right across. Water and those ions go right across. Here's a very simplified version of what I just talked about. Here's the artery here, and here's the glomerulus. Here's Bowman's space, or that area. And process number one is glomerular filtration. But look at the volume. This is per day. 200 liters of fluid per day goes from those blood vessels into this space. Stuff goes from the tubule back into the blood vessel. But what really happens is stuff goes from the tubule back into the blood vessel this way, and that's called reabsorption. We all know that we don't make 200